name is Cheska and I'm currently a fourth year student or a physical therapy intern here in FDU NRMF.
Hello, I'm Danina and I'm also an intern, a fourth year student in NRMF.
Ayan, okay. Thank you so much for giving us the time. I know you guys are very busy, especially fourth year, right? So you guys are really doing a lot of internship these days. Tama ba?
Yes.
Right. Kasi ganun din sa nursing. Anyway, okay. So let's start with the question. So what was your first impression when you met the physical therapy interns from Korea?
My first impression with my experience with the Korean interns is that I saw them as professionals since they are of older age than us. They are licensed, and of course they've already had their specializations for quite a number of years. So that's what I first thought when I heard that Koreans were going to practice here with us.
How about you?
Aside from that, when I first saw them, they looked very happy and jolly to be in the Philippines and to interact with us. So during their first day when they introduced themselves, they really started talking to the people near them. So it was very nice because they weren't like excluding themselves from us.
Okay, that's nice. That's nice to hear. Okay, so we're going to move on to the second question. What aspects did you find most impressive while practicing together with the Korean interns?
I think for my experience, I think what I find most impressive with them is that they try really hard to interact with us Filipinos, despite the language barrier, because they always try to be included, to ask questions, and to participate in the clinical activities, even though they have a hard time understanding medical terms in English, because I'm pretty sure it's way different from what they learned in Korean. But still, they try their best. They don't show that they're unmotivated to do these things because of the language barrier, but rather they really try to get involved, to ask what we are talking about so that they'll know the context of what's happening. So that's what's for me.
Nice.
And then for me, since we are currently in the community-based rehab, some of our patients don't really speak English. So what I saw from them was that they were really culturally competent because they were also trying to adapt to our culture and trying to connect with our patients despite the language barrier. So they were also learning English and Tagalog at the same time, which they're really good at.
I heard. Okay, alright. So for number 3, what differences did you notice in clinical approaches or patient attitudes between Korean interns and Filipino interns?
I think for me it's too early to tell because it's hard to gauge how they interact with these patients because first of all, there is a cultural barrier. We don't know how they handle Korean patients because there's an entirely different concept than how Filipinos handle Filipino patients. That's an entirely different culture since most likely you would have to align with your patients when you treat them. But from what I noticed, of course for us Filipino students, we engage more with the patient conversationally. And with Koreans, of course, because everything is new to them, the practice is very new to them, even the language. So, of course, they're not as interactive as us when it comes to treating patients.
Right.
For me, I think what I noticed is the attitude. So for us, we try to be a bit firm sometimes, but then from what I saw from them is that they were very patient and they were very willing to let the patients connect with them and talk to them. So they were very open with the patients.
Oh, very interesting. Okay. And then, what have you learned or discovered while working with the Korean interns?
For me, again, it's too early to tell because like my experience from the past month is in a very specialized center, which is cardiac rehab, and not every intern can rotate there, so not everyone is very knowledgeable with cardiac rehab as well. So same with the Koreans, they also said that they were not as experienced with cardiac rehab since it is very specialized. And when we try to ask something about their specializations with the Korean interns that I've had experience with, they have a hard time explaining, because sometimes we ask, oh, what are your tips for this specialty because you specialize in that? They're having a really hard time explaining. So they tell us, oh, it's hard, I can't explain because it's gonna be in Korean, which I understand, because I think we both have very different curriculums when it comes to PT education.
Okay.
So yeah, that's what I noticed.
For me, I think with my partner, so currently we're treating a stroke patient, and what I noticed from her is that she's very detailed with correcting the patient. So for us, we mostly correct patients generally, but then from what I saw, she did not give up on that patient. She continued to correct her until we finished the 4 rounds. So from what I noticed, they're very detailed in terms of giving feedback to the patients, which was good.
Oh, that's really nice. Okay, so on the 5th question, were there any difficulties that Korean interns facing in adapting to the Philippine healthcare environment? If so, how did you help them or assist them?
For the most part, I could see that they really had a hard time adjusting with the healthcare system here in the Philippines. I've talked to some of them and they explained the differences. I'm with first initially evaluating their patients, because here in the Philippines, it's very comprehensive from history to objective assessment. Well, someone explained to me that when they do evaluations in Korea, they don't really take history taking like as an integral part of the hospital system, but rather just for themselves to get to know their patient better. And their objective assessments are solely for insurance requirements, from what I've heard. So I think that's the number one thing that they're having a very difficult time, because they think that our practice here is very comprehensive. So they're kind of having a hard time keeping up with that. Also, in the healthcare environment in cardiac rehab, us interns already have a hard time being familiar with theoretical concepts like anatomy, physiology, and that is already in English. But for these Koreans, they are having a hard time keeping up with these small group discussions in cardiac rehab and keeping up with the knowledge that has to be known when you're treating these patients. So since they are not specialized in this, and in addition to that, they are not very fluent with English and the English medical terms, abbreviations. So I think that's where they are having a hard time keeping up. So we help them, both staff and co-interns. We really took the time to help them, to translate in their context, to simplify the words, in how to take initial evaluations. Well, when they did their evaluation in cardiac rehab, they were accompanied by co-interns or by staff so that they could be properly guided. And we also told them and translated in simpler terms the theoretical concepts in cardiac rehab. That's what we did.
Similar to what Jessica said, I think they had a hard time with understanding the process of how we treat patients, from the initial evaluation to our daily notes to our discharge notes, since there was the language barrier. So I think that was the main problem itself. But in terms of treating patients, I think they were easily able to adapt to our practices, since at first they were assisting, but then by this month, at times they're the ones who mainly treat the patients. So I think that's good. And another challenge that I think they faced is that in the Philippines, community-based rehab is a huge part in physical therapy. So from what I saw during our first day, I think they found it hard that we lack equipments compared to what they had in Korea. So
We have advanced technology.
I think those are the challenges. So it was hard for them to like understand why we don't have these stuffs and why do we lack these.
Okay, thank you. We will move on to the sixth question. How did you communicate effectively with the Korean interns despite the language barrier?
Yeah, we would use body language. Sometimes direct English words in a conversational matter is still complicated for them. So we have to simplify these English words further. Or sometimes, since I do have a bit of knowledge with Korean because I watch shows, I went to K-pop, so sometimes I tell them the direct word translation so that they would get the context.
So for me and my partner, whenever she finds it hard to translate what she wants to say in English, she uses this app to translate for us to better understand what she wants to say and for her to easily express what she wants to say, because sometimes when she speaks in English, there are words that she doesn't know.
That's understandable. Okay, alright. So on our next question, this is interesting because do you have any fun experiences or episodes to share from your time with the Korean interns?
For my part, I did have a lot of fun experiences because what's nice about them is that they're really trying to be involved, not just clinically but socially, like with us Filipino interns. Like even though sometimes it's quite risky to like invite them somewhere else, they would say yes, because if I were a foreigner, I would have second thoughts in joining. But they really try that, even though they weren't able to, they aren't able to be fluent in talking to us in English. They would find ways and how to participate with our outings, with when eating out, and just having mini celebrations after duties. They will find ways on how to enjoy it with us.
For me, I think it was during our first day in CBR when we visited the barangay or the town. So from there we introduced them to different types of Filipino street food. So at first I thought they wouldn't like it, but then they were like very dumb, or they were like very interested with the Filipino street food, and they ate so much, which made me happy because I thought they wouldn't like it at first. And then we actually live near each other. At first I thought they won't say hi to me because I'm one of the 80 students in PT. But then they said hi, and I think they recognized me, which was good.
Nice, yeah. Okay, hold on. Alright, so on the eighth question, have you learned anything about physical therapy in Korea, or probably that some of their practices through the interns? What difference do you think exists between the Philippines and Korea?
What I've learned while talking to them is that the curriculum is entirely different, because I noticed from their stories that Korea has their own curriculum that they don't follow with other countries. So like in the Philippines, we pattern our curriculum with Western concepts, with Western books, Western textbooks.
Right.
But with them, you guys have your own. So like when I was talking to one of them, they were telling me that it's so entirely different than how they studied in college.
Right.
And I think, yeah, there's a really big gap with our clinical practice. So yeah, that's what I think.
From what I heard from the Koreans during their internships, they were not allowed to handle patients and just observe. So that's what I felt sad about, since I really hope that they were able to encounter different patients first during their internship before they go here or before they work in Korea.
Yes, actually, but yeah, that's their culture there. Okay. So, what suggestions would you like to make for better collaboration with future interns? Because, like what I said, there's going to be a new set of cohorts this June, so you guys are going to meet them. And so, what can you suggest to the students?
I think it would be very beneficial for the Korean interns to have formal English classes, at least learn intermediate language English, intermediate level of English, so that they could keep up. It's not for us, but it's for them, so that they wouldn't have a hard time adjusting, because adjusting in the culture is already hard enough.
Right.
But adjusting in a hospital that is an entirely different practice and an entirely different language, that's going to take off a bit of a load from them if they just if they improve more on that.
I think for me, they can also look into the healthcare processes in the Philippines, especially in PT. So how we perform our IEs, how we perform our notes, since it will really be a test for them if they want to go to another country. So if they can handle it, like adjusting to the practices here, I think it will also help them in adjusting to the practices in the different countries they might go to in the future. And aside from that, yes, English. Because I think they have, they're culturally competent, they're able to adjust, they're good at connecting to the patients and to the people they work with. It's just that the language barrier is the major problem.
Okay. What advice or messages would you like to give to the second cohort of interns coming from Korea? Maybe it be short advice.
Hello, future Koreans. My advice is that you take lots of sunscreen, stay hydrated. It's gonna be hot when you're gonna treat patients here, and that study medical abbreviations in English in advance. That's what I would suggest.
Hello. I think you'll enjoy it here. Yeah, just keep an open mind, and one tip, don't learn too much Tagalog. Because when you go here, you have too much fun. You forget to learn English and focus on Tagalog. Yeah. So just enjoy.
Thank you. So we are down to our two last questions. Please share some words of encouragement for the first cohort students, so this batch. So while you guys are currently training with them, so do you have any words of encouragement or words of support to your partners, to your buddy?
For me, don't be afraid to show like how you are in Korea to how you are here, because just keep asking questions. There will always be co-interns and staff who will be willing to help you if you ask questions, if you have the heart to actually learn from them. So don't be scared, because everyone will welcome you with open hands. So fighting!
Okay.
Hello everyone. So for this batch, I think you're already halfway through. And I think you guys are doing a good job. So just continue learning and enjoying the things that you get to experience in the Philippines. And I hope that whatever you guys learn, you'll bring it to wherever you'll go in the future. Yeah, so continue learning.
Thank you. And finally, what are your future aspirations and goals as a physical therapist? And is there any interaction with the current interns that influence those goals?
For me, as of now, I'm trying to aspire to specialize on pediatrics, I think. Just my first thoughts, and I want to continue my practice here as of now. And my interaction with Korean interns have, they gave me this insight that if you really want to chase your dream, then you will really do it. You will find ways on how to do it, like how they did that. I actually find them very courageous for going here despite not knowing anything about culture, how things are done here. Like no one told them how it's gonna work here, but they're going to experience it for themselves, discover it for themselves. So I think it's more on taking risks for your dreams. For me.
I think we have the same. I'll be going through the same path as them. So I also wish to work abroad. Yeah, and from what I see not like a fully English-speaking country. So, just like them, I'm being tested on how I communicate with other people with a different language and culture from us.
Alright, so thank you so much for your time, girl.
Thank you.